Okay, today I'll be giving a speech about CPR. Imagine this, you're at home enjoying dinner with your family when you glance around the table and notice that your uncle suddenly has a painful and terrified look in his eyes. He grabs his chest and moments later falls to the floor unconscious. Would you know how to handle this situation while everyone around you is panicking? Would you know that your uncle was probably suffering from a heart attack and needed resuscitation or CPR? As a lifeguard, I was required to become certified in CPR, and I had been certified for 4 years in emergency. It's not your job to treat the illness, but you are to keep the victim alive until trained medical professionals come and rescue. Tonight I want to explain to you the process of surveying an emergency. Contacting the emergency medical service and starting CPR if needed. Let's start with the first steps of surveying an emergency. According to the American Red Cross, the first step is an emergency is to survey the scene. The most important thing is remembering and administrating first aid is to make sure the victim are safe. You don't want to put yourself or the victim in any danger. If it is safe to proceed and the victim is not moving, you check the victim for responses. Call the victim's name. If the victim does not respond, shake him or ask him his name. Now that you checked out the scene and know the victim is unconscious, the second step is an emergency to contact an emergency medical service. An emergency medical service can be numbers of contacts. If the service is offered in your area, call 911. If 911 is offered in your area, call the hospital or police directly. And if you don't have those numbers, you can always call the operators, or he or she will contact you for the correct officers right away. Designate one person to contact EMS. If there is no sound, if there is no one around, you must call the emergency medical service yourself. Give them your name, address, and the victim's name. Condition and the aid begin giving. It's important to remember to let the dispatcher hang up first, so that you know he or she has more questions about the ambulance, so they can send them right away. After the EMS has been called, return to the victim and perform CPR. First, position the victim. Move the victim in the correct position. Try to keep the person's body in the appropriate form. Then place yourself to the next to the victim's shoulder and check the ABCs. Open the airway, check for breathing, check the circulation of the pulse. First, open the airway, take the hands that's closest to the victim's head and put it on his or his forehead. Next, take the two fingers of the other hand and put it on the body part of the victim's chin, tilt back. Next, check for breathing. Look, listen, feel for the breath. Look for the chest rising and falling. Look for the breath in the air. Feel the breath on your cheek. Do that for about 5 seconds. If there's no breathing, you must give two full breaths right away. Take 2 fingers of the hands on the victim's forehead and pinch the nose shut. Then take your mouth and seal the victim's mouth, giving 2 full breaths so that no air escapes while you're trying to breathe. Then check the circulation or check the pulse. Take 2 fingers and put them on the center of the victim's throat and slide them up and down. Do this for about 5 seconds. If there is no pulse, check for compressions. Position your hands on the victim's chest. Take 2 fingers on your hands that closest to the victim's feet and slide your hands up on the bottom of the rib cage until you reach the notch that is directly beneath the breastbone. Continue the cycle of breathing compressions for 4 times. After the 4th time, check the victim's pulse again. In conclusion, this speech has shown you the importance of surveying an emergency and administrating CPR correctly. Now let's go back to the emergency situation. Now, because of your knowledge of the 3 steps in administrating CPR, you can be the vital link in an emergency and you can help save a life. Thank you.